communities and also vibrant communities. But I've got staff based obviously all over East Ayrshire, but my main touchdown is up in Western Road.
Right. Be nice to have grab a coffee with you the next time you're in.
Yeah, definitely. That would be great. So it's looking lovely. I've not been in since you guys took over early stages, but I'd heard about all the lovely plans, so it was lovely to be in yesterday and see just the changes that have happened. It's amazing. So I'm looking forward to being back in on Saturday again as well.
Hi Hilary. Oh, you're on mute.
Hi Paul.
How are you?
I'm fine, thanks. Yourself?
Yeah, I'm good, thanks. Just bumped into a neighbour there that I didn't meet before, so someone else from Kilmarnock.
Oh, that's good.
We'll just give it another couple of moments. If you have just joined, if you're able to put your cameras on, that would be lovely. Just leave yourselves on mute if you'd like.
Eve is actually one of the technical people that's helping here, so she might just keep her camera off.
Brilliant. Well, I think we'll probably just get started. Oh, Catherine's just coming in now.
Hi, Aileen.
Okay.
Good afternoon. Hi there. Nice to meet everybody.
Hey. I've got a couple more people just joining now. Hi, everyone. I think we'll just get started, and then I can admit people as we come along. It's lovely to see you all. My name's Ancha.stoodley, and I'm the Neighbourhood Transformation Team Manager here down in Walker. And I'm as part of the delivery team here in Walker with Building Futures East. So I'm going to be just letting you all kind of have some insights into what we're doing down here in Walker. I just started in June, so Paul has kindly come along as well to remain in the background if there's any questions that anyone has that kind of what happened prior to me starting in June. I was hoping to have one of our volunteers come along, Rachel, but she's having some problems actually getting on. So we were going to have Rachel tell her story at the end as well. So if she can't get on, then I will just tell a little bit about her story, which she's allowed me to do as well. So just in terms of a little bit of housekeeping, if you want to put your cameras on, then that would be great to see everybody. If you just keep yourselves on mute for now. If you have any questions, please just pop them in the chat. We'll have plenty of opportunity at the end to ask lots of questions, and I hope you all do, maybe some challenging ones as well, which would be great. And I will just obviously just share a presentation with you as well. Okay. Can everyone see that okay? If you just give me a thumbs up. Yep, perfect. So this workshop is obviously about the replication of the Lifting Neighbourhoods Together approach in England. And I'm just going to kind of obviously fill you in a little bit about the area for those of you that don't know Walker. So Walker is a residential suburb to the east of Newcastle. And just a little bit of history that I was looking up that I didn't know myself actually in terms of the name of Walker. It goes back to 1242 and very much linked to Hadrian's Wall. So Hadrian's Wall came to the north side of Walker, and parts of Hadrian Wall can still be seen in one of the neighbourhoods, Byker along the road as well. In terms of kind of main employment for the area, it was an area of large-scale coal mining, which began in the 1700s, with up to 10 collieries in the area. And predominantly from there was also a large ship building industry. And a lot of the kind of older generation of worker that we speak to now have, were employed in the shipyards. So kind of going back to that period of thinking about community, it was an area where there's this high level of housing, but there was a real kind of community spirit, very much based around the pits and the shipbuilding industry as well. I'm just going to admit Gillian there. So in terms of sort of some demographics for Walker, I know John mentioned it earlier on as well. Walker is the most deprived area of the northeast and is 32nd in England in terms of deprivation levels. 92% of the residents identify as being white British, although that is change. Obviously, these statistics aren't up to date, and we're seeing that change quite rapidly in terms of Eastern European residents who have, especially around Ukraine and other kind of countries as well, who are coming to reside in Walker more recently, which is great. Annual household income in Walker is around about 20,000, in real comparison, stark comparisons to other areas, even in the northeast, 28,000, and in England and Wales, 34. So we're really seeing like really high levels of deprivation. And as we would all imagine, especially with the cost of living crisis and COVID, people are really, really struggling in the area. Crime rate as well is really high in comparison to other areas that you can see there as well. Which is kind of evident when we're talking to local residents through door knocking. So I know obviously John talked a little bit this morning about the neighbourhood transformation team and what that would kind of look like in I guess as an approach and in principle. And these are the areas that we would be looking to kind of, as we build this transformation team, to support people in the local area around very holistically around young people, children and families, housing, education, training, relationships and isolation, benefits, bills, money, work and pay, community, health, mental health and well-being. But obviously the list isn't exhaustive. It's very much a holistic team that we'll be looking at supporting local people in Walker with. So we've been making really kind of, I guess, quite strong links very recently around kind of building this neighbourhood transformation team since I came in post. So in terms of the kind of staff that we have, in terms of paid employees to the actual approach and the system that we're working with, is myself and our health casework manager, Claire, who's unfortunately on annual leave this week, otherwise she'd have been here with me. And other than that, it's really about like the approach that John was talking about building the team based on external time donors, internal time donors. And then as we've been kind of moving on, looking at kind of the impact of having our community volunteers involved as well within the team, and how much lived experience and wealth of knowledge that they bring to us as well. So in terms of external time donors, we've got a community pioneer from the local churches network who's going to be starting with us next week. We've had discussions with Mental Health Concern, who are hopefully also going to be kind of involved within the neighbourhood team. Nardos are offering us some of their volunteers to help around family support. So that's not just family support for younger children, but also youth support as well, provision, which is a great addition to the team. We've got somebody from the Newcastle City Council, a community wellbeing officer, Callum, who you can see in the bottom right-hand corner there. And we have also have Keyring, who's just started with us, and they're an organisation who support people with learning disabilities and also older people, and Independent Age, who have just come on board with us as well. And they're very much obviously about supporting older people, normally of over 65 years old. In terms of internal time donors, so Building Futures East is very much a regeneration charity. So we have different programs running alongside Lifting Neighbourhoods Together, very much based on employability, helping training for local people. So we have 2 link workers who I'll show you photos of in a minute, who are dedicating a day each a week to kind of employability and training and the support that can be given to local people around that. as well as kind of helping do our door knocking approach and really getting out into the community and listening to the views of local residents. We've recently identified a couple of local people who have been absolutely amazing. Rachel, that was hoping to join today, which I don't think she's going to be able to get on, is there in the left-hand corner. She's our volunteer content officer, but we couldn't really find a title that would kind of, I guess, fit for everything that she can do, but she was really happy with that title. And then we've got another volunteer who's we've well come up with a title for her that she's wanted, is the community engagement officer. So Kathy, our other volunteer, has come through one of our groups that I'll talk about in a moment. She came in really lacking in confidence, just really kind of I think liked the atmosphere of being around kind of the office environment, being out in the community. She's lived in Walker all of her life. She knows virtually everyone, I think, in Walker when you go around with her, and she just loves coming out and knocking on the doors with us and really kind of getting to know the local community. She's then also linked in with another community member, and they're really keen to kind of look at further activities for children and young people in the area. They're all planning a Christmas event, Santa's Grotto, so really proactive in the community. So we're really lucky that Kathy's come on board with us. Kathy is also being encouraged to go back into work after taking on the care of her grandson on a full-time basis. So we're kind of supporting what that might look like into some sort of employment that would be manageable for Kathy, alongside kind of what she's got on already. So I think this role's really kind of helping her in terms of her confidence, but providing us with loads of knowledge of the local area and kind of, I guess, you know, some insights of might be what might work and what might not work. And for Rachel, I will tell a little bit about her story, as she's allowed me to do that a bit later on as well. But Rachel has some background in kind of journalism in the past, and we were talking to her about how we can come up with some content for flyers and for Facebook that's really a bit more engaging than we were doing. So Rachel is really helping us with that. As I say, she lives in Walker, she's lived here a long time, she has some really good insights of kind of what is maybe more appealing than what we've had out on offer as well. And then in the future, we're also looking at potentially trying to kind of train up some local people in terms of health champions to support Claire's role as well, and the impact that could have more long-term within the community as well. So that's in the plan. So in terms of employability, we were kind of thinking, how can we make this sound, you know, something that actually people want to come and they want to kind of get the support around kind of employment. We know there's so many services out there offering CVs that let me get you into work, a bit like what John was talking about earlier, this silo of different people doing different things. But actually, you know, I think people just want to come and have a cup of tea and a chat and, you know, find out kind of, you know, is this going to be for me? Is this worth me coming off my benefits? Will I be better off financially? Because I'm already worried about the situation. So we've been kind of working on this with Ebony and Joe, who are our internal time donors through Building Futures East, looking at a fortnightly drop-in. So it would be based in our office that I'm in now, which is in the heart of the community. So it would be a matter of just people just dropping in on a Monday, probably between 10:30 and 2:30, having a cup of tea and a coffee, you know, cup of tea and a biscuit with us, and really kind of identifying what would really help. And Joe and Ebony will be on hand to really offer those practical skills for people and the support around CVs, covering letters, interview skills. So if somebody says, I think to themselves, I feel a bit more comfortable with Ebony, I'll go into another room with her and we'll practice some interviews. You know, that's a sort of level of support that we'll be able to do. We'll be able to link in with local employers and recruitment agencies as well. So we've got really strong links with St Anthony's of Padua Community Association. They employ over 100 local people, predominantly in care work. So, you know, it's about kind of thinking about, can we link in with these local employers who, you know, where it would be a really good kind of, you know, transition into work for people. We can offer free SIM cards as well, so that people can do those job searches. So that very practical support. We'll also be having that more holistic support of health on the day as well, which I'm going to talk about in a moment. So I won't talk about that too much now. Biker Job Centre, so Joe will be having a presence within Biker Job Centre to kind of like encourage maybe Walker clients to come along, Walker residents to maybe, you know, come to something that's a little bit more local to them as well, that might be a little bit more inviting and appealing to come along to. Link with community groups, so Ebony and Joe can be on hand to any community groups, you know, to actually go and, you know, I think we were talking about, you know, I was listening to the earlier sessions around kind of, you know, making sure that we go out and reach out to people where they are as well, so they'll be able to go out into different community groups where people feel at ease attending. And then there's volunteer opportunities within the neighbourhood team for people like Kathy and Rachel that we've spoken about as well, to kind of, you know, maybe help them to kind of get that confidence back into employment. That's just a flyer that we've come up with at the moment, that Rachel has kind of helped us with some of that sort of content for that. And then just want to talk a little bit in terms of health. So this is Claire, our health casework manager, who works alongside me in our office here in Walker. We're really, really fortunate that Claire comes with the background she comes with. So she's had 15 years working for a local organisation called Healthworks, and she's trained in lots of different areas of health, is so passionate. You'd know if she was on the screen, she just oozes passion, and was originally from Walker herself. So she knows the area very well and very passionate about some of the health inequalities in this area compared to other areas of Newcastle as well, and what can we do about that really, and how can we kind of support the community to like, you know, say this isn't right, we need something better. Claire's also trained to be able to do point of care testing, so she can do blood pressure, she can do EKGs to detect heart rhythm abnormalities, and also do sugar testing, glucose tests. Claire comes with her own story as well around her health and how she's had a, you know, significant journey. So she often tells that to kind of really help engage people in the community around thinking about their health in a different way, you know, so it's not judgmental. It's very much, you know, these, you know, we could think about small steps. We're very conscious of the cost of living, that, you know, maybe somebody trying to change their diet and the way they eat might not be the easiest thing to do at the minute when we're talking about just putting food on the table. So Claire's really realistic in kind of the support she can offer. And very much looking at support around increasing activity, reducing social isolation, the healthy eating, increasing the mental well-being, stop smoking, and type 2 diabetes, which is really high in this area as well. And she's got the ability to give that advice and support around that. So again, in terms of health, you're looking at that more holistic approach of the, you know, of the neighbourhood team as well. It wasn't about kind of Claire being based here in this office expecting people just to come along and see her. When we said it's about really how do we engage with the community. So we are fortunate as well that we've got an Aldi, which is right next to our building, and they've been absolutely amazing at kind of, you know, just kind of, you know, thinking how can we work together. So we had a table there in Aldi for kind of about 4 hours. So we were, and the Aldi where we are based as well is not on a road where you're going to get a lot of commuters. It's very much a community kind of Aldi. So it is very much local people that attend that Aldi. So they were very happy for us to have a stall there, and Claire did the point of care testing, and we were able to engage with a lot of the local community. Sorry, that's my light's just gone off in here. And it was just really great to kind of get out there and really engage people as they were doing the shopping and tell them more about kind of what was on offer for the neighbourhood team as well. The Boston Youth Club is being based here in Walker for a lot of years. The youth workers there are all Walker residents themselves, and they have such a good reputation with the local community. So Claire's been going along to, they have a group on a Monday, which is for, well, predominantly parents, carers of the local area, and it's so well attended. I think it's just one of those organisations that's trusted in the heart of the community. So Claire's been going along there as well to kind of look at kind of the health of people attending, and do the point of care testing, but also be able to give that support and information and advice around that as well. She's been attending a group at Walker Parish Church, other local community groups, so she's on hand, so she'll be on hand when we do the employment sessions as well. So it's that, you know, one-stop shop of that holistic support for people. They can come in and start thinking about their CVs, but also go and get the blood pressure checked at the same time. So there's not many places you'd be able to do that. So she's kind of really looking at those like ways to be really proactive to help think, for help people to think, a bit more differently about their health. And she was on hand at our recent community event that we had last week as well. So that's very much about informing, motivating and enabling people to prevent or better manage lifestyle related long-term health conditions in a way that's realistic to their needs. Apologies for it being very text heavy, but just really wanted to give you some sort of information about some of those kind of things that have been happening really. So she's delivered 12 sessions to community groups for older people, people with learning disabilities, kinship carers and people experiencing social isolation, and 39 point of care tests were carried out in those community groups. Within the wider community, so that's looking at the Aldi event, looking at our community events, 44 people have had the blood sugar tests, and really I think it was quite shocking, the results that we saw coming back from all these kind of tests that Claire was able to do with people who they weren't going to go to the GP, they weren't going to get the test done anywhere else. It was literally, we were on hand, so they were like, okay, I'll get it done. 13 people had high blood sugar and were experiencing symptoms of type 2 diabetes that didn't know, that they had no idea. So Claire was able to provide them with just that kind of, information straight away, and to kind of obviously support them accessing their GP for further kind of intervention, but also that Claire can be on hand for the more practical day-to-day support as well. 61 people had the blood pressure check, 21 had significantly high blood pressure and were advised to see their GP. And again, Claire was on hand to be able to provide that brief advice, but the follow-up with the GP. Again, none of those people knew that they had high blood pressure. So, we were able to help them to kind of get that support straight away. 63 people had a heart rhythm test check. And I won't pretend I know all of those words that Claire's put down there, but basically she was able to identify people that wouldn't have gone to their GP for that support. So in total, just since Claire's been with us in August, we've had 147 point of care tests were carried out in Walker area. So those, are with people that really wouldn't have accessed that support had, it not been on hand in community venues and things like that. So yeah, that's good. These are just some photos here of obviously in Aldi, and Claire doing some of the tests there as well at our Walker community event that we had last week. And this is just a story to share. Liz is a pseudonym, but it is a live case of somebody that we continue to engage really with different services. So Liz came on board through the door knocking. So we wouldn't have been able to engage with Liz in any other way had we not knocked on her door. She was retired, feeling quite isolated, hadn't left the house for some time, really predominantly due to mobility issues and issues with her lungs, and just feeling quite lacking in confidence. So we went back with some more information about kind of what was going on locally, and trying to kind of engage Liz a bit more in kind of how we could support her. So she decided to come along to the community litter pick because she felt quite strongly about litter that was in her area. She wanted to come along and get a little bit more active, so be involved with walking, the craft group, and the local community event that was happening as well. She was then able to be introduced to another local charity which also does some craft activities on a different day, and Chai Chi as well. She was able to have some information around her health, and kind of that encouragement and introduction to further kind of statutory services around musculoskeletal service, who've been able to provide her some support with strengthening exercises for her knees. She's doing absolutely amazing. So she's walking a lot more. She's feeling that she can kind of walk up hills a bit more as well. And she's kind of coming along to everything that's going on and taking a really active role in it. And I think in the near future, she will be taking one of the leadership roles for the craft group. So I can just see how far she's come on kind of that journey since we knocked on her door. So in terms of community engagement, obviously there's a different kind of avenues of community engagement, and predominantly through the door knocking process and approach. So far we've knocked on just over 2,800 doors and had just over 1,000 listening conversations. with 179 people asking us to come back in some capacity, whether that's further information, whether that's to get some further support through that next stage of what we would call the holistic assessment, which is that very much kind of, you know, just listening to somebody about all aspects of their lives and finding out what they would like to change and how we can kind of introduce them to different services to get that more holistic support. Through community events, so we had our first Walker community event last week, where we had just under 60 local residents came along, and we had 17 local services attend. So it was a bit like a marketplace of services for the community to come and find out what was kind of on offer locally. And we made sure that every service that attended was offering support within Walker. So it wasn't going to be a case of someone going along and saying, you're not in the right postcode, we can't support you. So that was very much that we needed that to happen. We had Walker Outdoor Week, which was in Walker Park, which was a great opportunity to link. I think there was around 500 attendees of young people and parents and carers at that event. And then obviously we had our Aldi Health event as well in October, which is ongoing. So we'll hopefully be going back to Aldi on a regular basis. Aldi is the only kind of supermarket in Walker. So obviously with other areas, other supermarkets or other kind of venues, we will be going back to those as well. In terms of community groups, these groups have obviously all been identified by people whilst we have been predominantly door knocking or through community events, really by the question when we ask people, you know, what do they do with their time, what they would like to see in the community. Craft was quite a big one for especially sort of the, I guess, you know, some of the older female residents that we were knocking on that would become quite isolated. Craft was something where I think a lot of people felt they could come together. So we've enabled the starting of the group here at our office, and it's kind of just, we've had a few sessions and it's going really great. And I think it's at a stage where, you know, the community will be, the community members will be taking on that leadership of that group very shortly, which is brilliant. And obviously that's got that sustainability for the future. They're already talking about having a kind of a knitting group as well, to run alongside Craft, which is going to be great. And it's been a lovely opportunity to see the women that have been attending. They've all been people that we've done door knocking, so they wouldn't have known about anything previously, and just coming together and seeing how they're really supporting each other. A couple of ladies who just don't go out the house apart from coming to the Craft group and haven't been out the house much at all in the last couple of years, so to see that interaction is brilliant. We've started a community litter pick as a result of people saying one of the things that they don't like and challenges them about the area through the door knocking has been the litter. And people saying it doesn't look very tidy. So that's become as a result of that. We've got the walking group because people are saying they're not very active. We've got a kinship drop-in, that's for kinship carers who care for their children on a permanent basis when the biological parents can't. The community forum, which I'll speak a little bit about in a second. And Claire has also run a diabetes listening conversation. And then future ideas, this is a result of kind of really that connection with other local services around the walking group. We've got a few local service providers who have got community gardens, where it's been a case of, I think someone might go to one kind of gardening group, and then they might not know about another one, or it gets a little bit precious, and one service doesn't really want to tell them about another one because they want them to come to theirs. So we've done a bit of work about trying to link all of these community garden projects together, and just had this idea of like a hop on, hop off walking group. So it would be a case of kind of almost picking up from a different gardening group, so they could go and see another one, and really linking in those gardening groups together. And one of the facilitators of another gardening group was talking about kind of, we could plant some bulbs on the way, and and it was just a really kind of nice way, I think, to engage more people within those kind of services and that's already ongoing. We've had a few people mention around they would be really interested in a men's group and a women's specific group as well. So that's something that we'll obviously work with those community members on in the coming months. And then further community events. So Kathy, our volunteer, who's linked in with another what we call community connector around kind of wanting activities for young people, literally collared me at the end of our event last week and said, "Ancha, we're going to have this every month." And I was like, oh. So I'm really encouraging them now to think about how we can kind of help them to make that, what their kind of vision for having kind of more activities for young people and children on a more regular basis as well. So just some insights from listening conversation. So I know there's obviously going to be further workshops around the listening conversation. So the listening conversation is what happens when we're at someone's door. And I know John spoke about earlier about the approach for that is quite specific, and I from doing the listening conversations and door knocking can really appreciate and understand why it works the way it works. You know, we don't go with a clipboard, but we do have some questions that we ask, and we ask it in a specific way where we have never, you know, in all of those door knocks felt threatened in any way whatsoever. We've been hit with warmth, and most people who want to have a nice conversation with you because they know that you're really genuinely interested in what they've got to say. So kind of the likes that people are coming out with really around that kind of like people they've often lived in Walker a long time. So they might have friends, family here close by, and that really means a lot to them. Residents frequently like their immediate neighbours, and that people are quite friendly. So they're talking about, oh, I like, you know, people 2 doors up, 3 doors up. That's who they know, and that's where they feel comfortable with. And then we're also hearing a lot of challenges in the area for people as well. So very much, I'll just let Catherine in, sorry. So the antisocial behaviour, the youth crime, and the impact on the local park, which is Walker Park, which is a lovely open green space, which residents are often telling us that they're not using because of the antisocial behaviour that's going on in that area. The substance misuse and supply of drugs as well in the area, and the use of motorbikes and electric scooters, which I think is probably quite common to a lot of areas at the moment as well, which is massively impacting on people and in a really negative way. You know, the motorbikes might be going up at 2 o'clock in the morning, they might be waking the children up, might be children with additional needs who they've just got off to sleep, who are struggling with noise. And so it's having quite a significant impact on the local community. The lack of facilities. So, you know, we've got, it was a very large, you know, well-known leisure centre in Walker called Walker Dome, which over the years has just diminished until there's not much there going on there really now, and that seemed to happen very quietly. So it's about, you know, can we find a way to help the community really get their voice out around, we need more going on in our area for physical activity. Youth provision and shops as well has come up as a challenge for people. There's not much going on, and that real lack of available health provision. So people saying we can't get a doctor's appointment, we can't get our blood pressure done, you know, even the basic needs like in dentistry and things like that. And then litter has come up time and time again, being kind of, you know, an area that people really feel, you know, it just doesn't look very nice, the area anymore. So I've just got a few photos to share here with you. So the one on the left was our community event that we had here at Treetop Village last week. Where, as I say, we had around 60 local residents came, and we had 17 services. So it was really that drop in, come and see what's going on, talk to services on hand. That's the event that we had in the park for Walker Outdoor Week on the right. Below is Claire and one of our local residents on the litter pick. And then we've got the kinship group in the middle there as well. This is our craft group, which, as I say, is going from, shouldn't say our at all because it's their craft group, and it really is. It's going from strength to strength. So a lot of pride's going into, I think, some of the things that the ladies are doing. We're hoping, we've had some funding that's come from a private donor to help with the craft group, and we're helping the group to look at access some additional funding through the Elders Council, who came to the group last week. So that will hopefully help give them a little bit of money for that to be sustainable. And as I say, that will take, there will be ladies that will take that on in the next couple of weeks. I just wanted to share some of their artwork there, which we kind of, you know, we were talking to them about what they would like to do and thinking about what community means to me as well. So they did some lovely art there around what the community meant to them. So this is just some feedback that we've had for the groups that have been going on, and you can see really, I think the kind of thing that stood out really is that everybody that's attended any of the groups or the event said that they felt more connected to the community by attending, and they felt that their knowledge of local services had increased. Everyone said the knowledge had increased by attending the community event. 100% would attend future groups and community events in the future. and the services that attended Walker community event felt that they felt more connected also to their local other services going on around them. They knew what was going on more, and that they also felt more connected to the local people in Walker as well. So I think that event was a great way to kind of get the services working, you know, better together locally as well as kind of connecting in with the community. And just a couple of quotes there as well that came back from those events. So I think it goes back as far to John's point earlier on about, you know, I've presented you with like all the stuff that's going on great and how wonderful it is, but also, you know, we are at that stage where we are hitting challenges, you know, and some of them are quite big challenges as well. You know, we're at that stage where we're really reflecting constantly on what's going on. So you'll have seen, I kind of skimmed over, we did a community forum. So we all thought, we were door knocking, we had lots of people saying, I'd like to get together to discuss this more, of a cup of tea and a chat. So we said, how about a community forum? You know, we put the word out there, and then we sat here and waited and thought, oh, we had about 2 people come along. So it was just quite an interesting, I think, reflection for us all about that. You know, people are telling us they want to come along to something, they want the change, but actually in reality, why did that not quite happen the way we thought, I guess, you know, that it was going to happen? So I think some of the reflections we came across is that, you know, I think some people in the area, you know, they're a bit fed up. They're a bit fed up that, you know, nothing, like I've put some quotes here, nothing changes. I've tried so many times. So I've spoken to this person, I've spoken to the police, nothing changes. Why is this going to be any different? So yeah, and there's some people around that real fear aspect that, you know, we shouldn't take, you know, lightly, that people say, you know, I don't want to report somebody, or I don't, because I'm fearful my windows will get put out. You know, and there's that, I just want to keep myself to myself because that's the best way to go about it in this community. So I think, I guess for us in terms of the neighbourhood team, it's about kind of how do we really kind of rebuild some of that trust and empower people to kind of, you know, to start to come out. How do we, you know, put things on that are going to be appealing, that people want to come to, that they want to really get involved in? And, you know, we really reflected on that community forum and kind of said, you know, we need to do this really differently. We need to think about, do we do evenings, do we do weekends, you know, do we do online as well, trying to kind of reach out to people so that it's something that they really want to think about. How do we take some action together here? You know, do we need to go to a different venue? Do we need to do this really differently? So we're kind of, I think, at that reflection stage around that too, about the things that are going really well and the community are engaging, and kind of how we're building the team, but also what is it that we really need to think about doing differently. And I've just put that, I think it takes time to rebuild trust and empower people as well. You know, it's not going to happen overnight by any means. And I like that quote there, that trust is built with consistency. And I think everything we do, you know, I keep saying, when we say we're going to go back to somebody on the door, we go back to them. You know, we're not just going to leave it. It doesn't just get left. We must follow through things that we say we're going to do. Unfortunately, Rachel can't be with us. She's been messaging me saying that she's tried so hard to get on, but she can't get on, unfortunately. So Rachel has obviously given me consent to explain a little bit about her story before I stop for questions. So Rachel came to us. She has lived in Walker for a number of years. She came through our Freedom programme as she's suffered significant domestic abuse in her life. She came through the Freedom programme, which is run by Building Futures East End Women programme. She then started to kind of engage with the gardening project that we also run as well. And then the person who was supporting her at that point was like, and again, it comes back to silos within our own organisation, was we can't support any lot further with what we're kind of doing here. So referred her to Lifting Neighbourhoods. So we met with Rachel, we kind of, you know, we went through the holistic assessment and found out where she was at and the things that were going on in her life, and kind of I introduced her to Claire around thinking about her health and things like that. And to kind of cut long story short, she's you know, in terms of, I think she's just identified that holistic support's really helped her, that in the past she's been almost told, go here, go there, and hasn't done it because her life, it's just not fitted in with her life. But she felt that this was a much more, I guess, kinder, friendly way of kind of supporting. She's come along and kind of, seen Claire on a number of occasions. She's been involved in everything that's been going on. And we asked her, would you like to kind of do some volunteering? And she was, really up for it. So she helped at our event last week. She's also got like a really significant professional background as well. So she'd previously been a journalist in South Africa, and we asked whether she would like to think about helping with some of the content that we have, we were looking at for our flyers. We wanted to do some changes, and obviously, knowing that Rachel, in terms of her lived experience and living in the area, she was really happy to do that. So that's kind of how she's helped, really helped support the program, but speaks very highly as well of how that holistic kind of way of working and joined up way of working is really supported, and feels very passionate about how it can work in Walker as well. So I'm sorry that you've had to listen to me tell Rachel's story rather than Rachel, but she's an absolutely amazing individual. So I'll stop sharing now and just hand over to you for any questions. Has anybody got, Suzanne?
I'll start since everybody else has been quiet. So thanks very much just for sharing that journey. It was really, really helpful just to hear and put it into context. And to be honest, everything that you've said is no different probably from what we see within communities here, but the fact that you've put that dedicated resource in at that very localised level. And I suppose what a couple of questions or things that was just coming to mind from myself was around, what is the population size, particularly because I probably just missed that at the beginning, and kind of how and where is the resource coming from, or how do you resource what's happening? Is that paid staff? Some of it I know is through volunteers, but kind of where did that come from initially, just to start up? We obviously in the East Ayrshire, through Vibrant Communities, have 6 different teams who collectively probably do quite similar, but working alongside communities through them developing their own community-led action plan, identifying their priorities similar to what's been done. But we've not kind of probably put that wraparound at that very localised level, but we're certainly through some of the wider work within the council at the moment, looking at how do we become more neighbourhood or place focused, as opposed to the larger localities that we currently have, both from a community planning partnership and health and social care perspective. It's how do we ensure that kind of localised voice is really feeding through and that two-way process happening. So I'm keen, because I'm heavily involved in that, developing that work at the moment locally, and it's just to get some information from you around that.
So in terms of population, Suzanne, so Walker has just over 5,000 households and around about 11,000, Paul might not know better, about 11,000 population, I think is roughly it. So it kind of marries up quite nicely, I think, in terms of the approach and the project in Edinburgh. So they're very similar size of neighbourhoods. In terms of resources, paid staff to the approach is myself and Claire, who's our health casework manager, and everybody else involved is around that time donoring or volunteering. So it's other organisations who are coming alongside us. Most of those organisations have come on fairly recently, and they're donating about half a day of their time to kind of door knock, but we're looking at kind of more flexible approach as well around, them not just being based within the office, but what can they do for the community within this one area. So it might be if they want to do some workshops, or if they want to do any one-to-one support within this office as well, then they might be based here a bit more time than that too. Yeah, so and then obviously our volunteer time as well, which has been like so helpful, and especially having those people who are very locally based, who can offer just a totally different level of insights and kind of support to the programme as well.
Do you want me to come in, Ancha, and add a wee bit to that?
Yeah, that would be great, Paul, thanks.
So one of the concept for this, Suzanne, is that we don't create additional resource to develop it, that we try to see if we can reprofile stuff that's already there and people that are already there. And so what we do is we've given a lot of different organisations training in I'm saying our, until a month ago, I was the director of Lifting Neighbourhoods Together, so I still feel I can say our. We give them training in our methodology, and as John said earlier on, try to create a kind of bit of a cultural container. So that what we didn't want to do was create something where you had to pay for a team of 8 people to go and work in a small neighbourhood, and then, you know, when you try to replicate that over a bigger area, it just becomes unsustainable. So really what we're looking at is trying to see if we can work with what's already there. The overall programme, as John said, is 2.1 million of lottery funding over 5 years. There's an expectation that there's about an additional 2.7 million of donated time going into the programme, so it should be roughly about half and half.
Thanks.
I can catch up with you anytime in Kilmarnock and give you more of the background to how we developed it.
That would be great. Really appreciate your time, Paul, just for a catch up, just generally, but also in your new role now locally. It's certainly something that we're looking at from a local authority perspective about how we not necessarily realign services, but it's more around how we make best use of the existing resource within a local authority context, marrying that up with third sector and community partners around place to serve our communities in the best way we possibly can, and ensuring their priorities are heard and realised collectively rather than us doing things to them, but equally them expecting a service all the time, as well as about them being kind of involved in shaping what that looks like. And we see that in the very small community settings through their community-led action plans that they are that they've got lead and responsibility on, but it's how do we then connect that a bit better and at the centre through our CPP and council. So yeah, it's really helpful to just hear that journey from yourselves, and I'd be keen to pick up with you, Paul. That would be great. Thanks.
I think as well, just thinking about kind of the external time donors, you know, sometimes when you like thinking about trying to build a team, you know, I think sometimes I've been like, oh, I feel like I'm really pushing up a hill here and not getting